Welcome back to AM Northwest. Whether you have love handles, a tummy pooch, or a beer belly, there is a way to get flatter abs that no amount of sit-ups can accomplish. Here to tell us all about the LipoLift for the abdomen, we're happy to welcome back from aesthetic medicine, Dr. Jerry Darm, along with one of his patients, Chuck Hemming. Nice to have you here, guys.
Thank you.
Chuck, you had the LipoLift done on your stomach.
I did.
Yeah. Now, why did you decide to do that?
Well, when I retired 7 years ago, I started hitting the health club. And I worked at it, no matter how much I exercised or how much I watched my diet, I couldn't get rid of the spare tire.
Yeah.
And I just decided it was time to try something else.
So tell us about how, Dr. Darm, how the LipoLift worked in this case.
Well, the LipoLift is a laser that just goes under the skin, a very tiny, teeny tiny hole about the size of a cocktail straw, really, and goes under the skin, melts the fat, and then we suck the fat out and then put a, very tight-fitting garment on for about 3 weeks, and, it takes an hour, hour and a half.
All right, here's some before and after pictures, and the difference is remarkable. You see there, I mean, that really, how many inches did you lose?
Probably around 2.
Yeah. And afterwards, how much downtime? Did you have any discomfort?
No, there was almost no pain involved whatsoever. I think the first night after it was done, I took 2 Tylenol, and that was it.
That was it.
Were you awake the whole time?
No, I was asleep.
You were asleep.
So.
Was that by design, or are you just very boring?
No, I think I was boring.
Yeah.
I think I was boring. They call him six-pack Chuck now.
Yeah, God, that's so great.
Any pain? I didn't. You mentioned taking Tylenol during the process. Was there any pain? No, you were asleep. That's right.
No, it was virtually painless. I was amazed.
How long will these results last? Are they permanent?
Well, they should last forever. I mean, unless somebody gained 50 or 60 or 100 pounds back, because the fat cells are gone. In other words, there's nothing there to reaccumulate the fat. So if you gain weight, it will come somewhere else for the most part. But really, in that particular area, that's why it's neat for the chin or for these different areas. It just
can't let the chin
won't
go.
go away.
So that same procedure works for other areas as well.
Oh, sure. You can use it in the chin, under the arms. A lot of women do under the arms. The so-called bra bulge in the back. The inner thighs are a great area for this to be performed.
What did your wife say, Chuck, when you when the garment came off and she saw the new six-pack Chuck at home? What'd she say?
I think she was pleasantly surprised.
Yeah?
Do you feel better now?
Oh, very much. You'd be surprised just getting rid of that little bit of extra weight, and the self-esteem goes up too.
Yeah,
you
I
look
bet.
better, so you feel better.
I bet you hear that all the time, Dr. Darm, from your patients. They just not only do they look better, but they feel better. There's a psychological component.
Well, we've done 4,000 of these cases, and so it's a very the patient acceptance, the patient happiness with an aesthetic procedure is really gratifying, to be honest with you.
And I would think too, when somebody comes to you, they ask your opinion. You help them decide what the best procedure
Well,
is.
there's lots of different ways you can go. There are a lot of non-invasive devices, and we have them in our practice, but they're just not equivalent to this. And then there's the traditional liposuction, which is mechanical sort of tearing of the fat, which is a lot more pain, a lot more downtime. And just, not as, frankly, as safe as this particular procedure.
4,000 procedures you've done?
Over 4,000.
Wow, unbelievable. If you'd like more information, contact the folks at Aesthetic Medicine over in Lake Oswego, 503-697-9777. And you, too, can be just like Six-Pack Chuck. Very good. Good to see you. Thanks for sharing the story. We appreciate it.